I love working in the Broward County community. What I really like about it is the diversity. So many different cultures. I feel that despite there's so many cultures, there's still a heart to help one another. So I really love working and living in Broward. When I was younger, my little brother had a medical illness, so I was always in and out of the hospital. When you have a family member that has a chronic illness, you become very familiar with the hospital system and the way you feel with it. My parents, being first generation immigrants here in America, they encounter a lot of barriers just given their language barriers, given their transportation barriers and things of that nature. And my main motivation was to make sure that patients and other people like myself who had a lot of social determinants of health growing up had a very fair healthcare experience. The reason why I chose hematology, in actuality, it wasn't related to the medical condition my brother had, but I did have a lot of family members, and I still do have a lot of family members that battle with sickle cell anemia. I think Memorial is doing a great job to kind of address some of the social determinants of health that we see in sickle cell disease and to set the groundwork or the playing field for us to deliver more equitable health care for this population and other populations who may need that. So one of the things that Memorial wanted to do and what we are doing is now we have a Sickle Cell Medical Home. So within our Sickle Cell Medical Home model, we have a social worker that's dedicated to our population and also a healthcare wellness coach that helps patients to first identify these barriers and help us to give them resources that are needed too as well. The journey for me when I first meet someone with sickle cell anemia is to come in and to introduce myself and to tell them why this disease is so important to me. And then I just listen. I want to listen how their childhood was or is if they're still young and how their adulthood is. I want to learn about their family members. I want to learn about, of course, the medical complications of sickle cell. I want to know if they work. And then ultimately, I want to know what their goals are for their life. And then also their goals are in terms of managing the sickle cell disease condition. I would like to think that they can perceive my passion and my dedication to change the healthcare in regards to how it relates to sickle cell disease. I would like to think that they see me as a visionary, as someone that doesn't just look at things as is, but expects more and will work towards that.